Hi everyone, welcome to today's session. Today I am here with some contents regarding the importance of vitamin D. Can vitamin D protect you against COVID-19? For the past few days, we have been constantly hearing how vitamin D can protect us against COVID-19. But does vitamin D actually protect you from coronavirus? Let's understand the basic first. Your skin gets vitamin D when it is exposed to sunlight. Need of vitamin D. The vitamin is essential for bone growth and strength as it helps in the intestinal absorption of calcium, magnesium and phosphate. The vitamin D is fat-soluble and regulates the immune response of white blood cells by preventing them from releasing too many inflammatory cytokines. The excess of cytokines can lead to cytokine storm, which is a complication associated with COVID-19, reducing the acute respiratory tract infections and severity. Who is more at risk? Thus, the elderly and dark-skinned people might reap benefits from vitamin D supplements when it comes to strengthening their immune system. In dark-skinned people, the presence of melanin, which gives the skin a darker tone, lowers the skin's ability to make vitamin D on exposure to sunlight. Due to the lockdown in place and people not coming out of their homes often, the deficiency of vitamin D might increase in citizens. Let's see the study results. Evidence supporting the role of vitamin D in reducing risk of COVID-19 includes that the outbreak occurred in winter, a time when 25-hydroxy vitamin D concentrations are lowest. That the number of cases in the southern hemisphere near the end of summer are low. That vitamin D deficiency has been found to contribute to acute respiratory distress syndrome. That case fatality rates increases with age and with chronic disease comorbidity, both of which are associated with low 25D concentration. The average vitamin D levels are low in Italy and Spain. Surprisingly, these countries have witnessed high coronavirus death rate compared to North European countries. North Europeans have comparatively high levels of vitamin D from the consumption of cod liver oil and vitamin D supplements. Problems of vitamin D deficiency. Our study found that vitamin D deficiency was 63% in people with diabetes, 58% in people with pre-diabetes, 80% in obese people, which is worrying because these are risk factors for COVID-19. Vitamin D fights disease in addition to its primary benefits. Research suggests that vitamin D may also play a role in reducing your risk of multiple sclerosis, decreasing your chance of developing heart disease and helping to reduce your likelihood of developing the flu. Eat this healthy vitamin D rich food. Like dairy products like milk and eggs are rich in vitamin D. To overcome the deficiency of this nutrient, eat the following foods regularly: yogurt, cow milk, orange juice, oatmeal, mushrooms, egg yolk, etc. To reduce the risk of infection, it is recommended that the people at risk of influenza and or COVID-19 consider taking 10,000 international units per day of vitamin D3 for a few weeks to rapidly rise 25D concentrations, followed by 5000 IU per day. The goal should be raised to 25D concentrations above 40 to 60 Ng per ml. For treatment of people who become infected with COVID-19, higher vitamin D3 doses might be useful. Randomized controlled trials and large population studies should be conducted to evaluate these recommendations. So I hope you understand about the role of vitamin D in preventing COVID-19. See you on next day. Thank you. Have a nice day.